Hello, everyone, and welcome to our first episode of the Lube Tube. I'm so excited to have you here and just kind of go over why we're doing it and how we got to this point, and basically to help every single one of you listeners become a little bit more knowledgeable about your body and your health. This first episode is called Let's Get Comfortable. This episode is one of the ones that I think is going to be the most important one that we bring to you, just to basically introduce you to our podcast and just get you comfortable with kind of what we're going to talk about. Today's episode is brought to you by Celebrations Bridal and Prom, providing big city style and small town service since 1988. It's a nice little boutique bridal shop located in downtown New Braunfels, and if you get a chance, please go visit. I'm going to introduce myself first. I'm Jeanette Nashke. I'm a physician assistant. I've been a physician assistant for 16 years, going on 17. And I am very, very passionate about my job. I, in my career, have done lots of things. I've done emergency medicine. I've done trauma. I've done urgent care as well as family medicine. But in the last 3 years, going on 4, I've kind of ventured into women's health. And this is where I've truly found my niche and my passion. And I'm hopeful that this brings a little bit more information to you about your body. And basically, I can teach you what I teach some of my patients. So I'd also like to introduce my co-host. Her name is Brittany, and she'll be introducing herself here. So welcome, Brittany.
Yeah, there is actually someone else on this podcast. I am Brittany. I have been a PA for about 7 years now. So yes, Jeanette is definitely has a few years on me and lots of knowledge. But I am here to bring my knowledge that comes from specializing both in internal medicine and doing some women's health as well. I wasn't sure if women's health was something that I wanted to specialize in, but during my time in PA school, I really found my passion working with women, and I think that it's really been a great addition to my internal medicine. So I'm happy that Jeanette decided that we needed to do something like this. So hello, everybody.
Awesome. So a lot of people have asked me, why or, what makes you want to do this? And I have the same answer over and over. And it's because every day, all day, every day on my work days, I spend with lots of women. And we're talking every age group. We're talking, the youngest I see is usually around 14, all the way up into postmenopausal. My 80-year-olds come and see me. And what I find is that every single one of these women have something in common. And that one thing in common is how nervous they are to talk about their own health. And I hate that for them. And I then realize that even when I go to the doctor, I'm also nervous, even though this is my specialty. And when I go see my gynecologist, I'm still nervous to bring things up. And so my whole goal of this podcast is to talk about those things that we are so uncomfortable with talking about, right?
Absolutely. And why are we uncomfortable talking about it?
Well, I think that there's been a stigma, right? We're not allowed to talk about our bodies or our, oh my God, I'm going to say it, vagina.
But also, I think the stigma has been around for a long time, right?
Agree.
Our moms definitely felt this. Their moms felt this.
Right.
And I think that it's about time that we change that because honestly, women's health is so important and there's no shame. There shouldn't be shame.
Right. Absolutely. And the amount of women that come and see me and they literally are scared to talk about even their period, right? I mean, we all have them, right? We all go through these stages. And what I think is also important is think about how many stages we go through as a female. We're pre-pubertal, so we're little girls. And then we go through our first period, which is, oh my God, scary. Mine was awful. I can still remember where I was when I started my period. And oh my God, I was so scared.
Me too.
Yeah.
Me
Were
too.
you at school?
No, I was at home and I knew what was coming because my mom had actually given me a book.
Oh, a book. Oh, that's nice.
Well, this kind of piggybacked into what we were saying, right?
For sure.
There's a stigma of sorts. So I learned, and no shame to my mom. Love you, Mom. It had nothing. I mean, I at least was educated about it, so I knew what was coming.
Right.
But I was at home and I called her on the landline because we didn't have cell phones. There I go, aging myself. And she gave me direction, which it was fine. I can only imagine if it had happened at school. What happened with yours?
Oh, I was at my grandparents' 50th wedding anniversary
Oh,
party
no.
at Papado's Seafood House. Yeah. I was like, I'm going to go to the bathroom. And then I wipe, and oh my God, I thought I was going to die. Thankfully, my older cousin, shout out to Kristen, was in the bathroom with me. And she was like, oh no, that's okay. That's normal. And honestly, yes, my mom, I love you too, Mom, had told me that this could happen. But I was one of the older girls in my class because I have an October birthday, right? So I was one of the first ones to start my period. And I was so scared and so nervous, but thankfully my cousin went out and told my mom, who then got me, and then we went to Walmart really quick and got some maxi pads. And I just remember thinking almost like a feeling of, oh, this sounds terrible, but shame, right? Like, oh my God, I started my period at my grandparents' 50th wedding anniversary. Is that all on me now, right? And had to hide it, and I felt embarrassed. And did anybody else know besides my cousin and my mom? Probably not.
No, ma'am. No.
But anyways, going back to what I was saying, I see these women and they're prepubertal, and then they have their first period. And then what? Then we go through the cycle of having a period, maybe abnormal periods. Maybe they have periods every month, or maybe they're not bleeding, but every 3 to 6 months. And what that means and why that period not happening all the time. And then I see women who are trying to conceive, and then they have a pregnancy, or maybe their first pregnancy loss, which is daunting, right? Absolutely terrible. And it's one of those also things that we as women go through. And if you've ever had one, which most of women that I see maybe do have this, and they just think they're the only ones in the world that are going through it. So I help them through that too. And then they go through their pregnancy, and then, oh my gosh, postpartum, when all those hormones are changing and you feel lost and scared, and your boobs are doing things that they've never done before. Your vagina is doing things that it's never done before. And then moving into that normal life back again after kids. And then there's the perimenopausal period, where your hormones are wreaking havoc on your body. The estrogen's going up and then going back down, and then going up and going back down, and it's not making any sense. And where you thought you had it all together, now you're wondering, do I need to start an antidepressant? Why do I feel so anxious all the time? And that's never been you before. So I like to help people through that, and make them realize that that's normal, and
Right.
kind of help them through that.
Then we have the stage that happens after that, which
the menopause.
again, it's something that is certainly not talked enough about.
Absolutely.
That can further wreak havoc. And our moms, our grandmothers, they didn't talk to us about this.
No, and they don't feel like they can talk about it.
Right.
I mean, half my women that are menopausal, when I ask them how they're doing, they're just like, oh, they're fine. There's no way you're fine. You have now lost the one hormone that made you feel like a woman. And what does that feel like now? I mean, are there some ladies that go on their whole life and not feel any symptoms of menopause? Yeah, those are the few and far between.
Blessed.
Though.
Hashtag blessed.
Hashtag blessed. Right?
That won't be me.
No, I don't think it's going to be me either. But you know what? I'm so glad that I have you to talk about it with, and I'm glad that you have me, right? But not everybody has that. And so coming back to my reason why, I mean, this is going to be that place, right? This is going to be that place where maybe you can just be a fly on the wall and listen to what, you and I have to talk about, and maybe get some questions to answer, or some answers to your questions that you may have that maybe you've thought about that you're only comfortable talking about after a few glasses of wine, right?
Oh, yes. Yes.
What's your favorite wine?
Oh, well, if I want to be economical,
okay. Oh, always.
I go to Trader Joe's.
Oh, yes, TJ's.
Yes, and I believe it used to be a $2 chuck. Now it's a $3 chuck.
Oh, so it went up.
Yeah,
Of course it did.
inflation. Yeah, inflation. And they have a really good cab that I like.
Okay.
But
so your red wine.
Red wine, or I just get my La Marca Prosecco.
Yeah.
Put a little strawberry in it.
Oh, well, yeah, you guys have to make it healthy.
Right. It's super healthy.
Nutritious.
Yes, what about you?
Oh, I'm a white wine girl. I do love me a good red normally during the fall, but here we go again. Perimenopause has made my heart do funny things when I drink red wine. And I've read about it, and I've tried to figure that out. And I think it might be, all the additives during the process of making the wine. supposedly there's a really good clean wine out of Napa that doesn't do that, but I'd have to actually try it out. But anyways, red wine, I do love the taste of it, and I love that it has so many different bodies to it. But I'm a Sauvignon Blanc girl. I'm a white wine girl.
Kim Crawford.
Oh, yeah. Kim and I go back, But shout out to my girl, Ashley. She introduced me to this amazing wine and from a local grocery store, which if you're not from Texas, it's called HEB.
Oh, no.
Yeah. Yeah. It's so good.
Should we get them to sponsor us?
I don't know. You think HEB would sponsor a women's perimenopausal, menopausal, premenopausal podcast?
Maybe.
I don't know. But yeah, so I absolutely recommend a Sauvignon Blanc, but I am also a Prosecco girl.
Okay.
Mm-hmm.
Okay, I can take that.
Mm-hmm.
So let's move on just a little bit.
Okay.
I want people to know how this whole podcast came together and where it all began.
Okay. I'm a chicken. You're my best friend. I think you can attest to that. Yeah.
100%.
Mm-hmm.
Yes.
So this has been my idea for 3-ish years, right? Probably a little bit longer. And I've wanted to do this for a really long time, but never had the guts to push forward. And you've always been my little cheerleader in the back, like, do it. You just need to do it. And you know me, I'm not very good at that. So
right.
Mm-hmm.
So truly, this is all happening because of me. I'm kidding.
Yes.
I just knew that you needed that extra push, and all I really needed to do was just buy some microphones.
Oh, they're nice.
They are, aren't they?
Yeah, they're really nice.
So again, Jeanette really is the true creator, but I helped push things along, and this is just our little love project.
Yes.
We're hopeful that if just one person can get something from this, that we have accomplished what we want to do. We don't want people to ever feel like they're alone in their journey of life, truly, because as women, I mean, we have a lot of things, right? We have our friends, we have our family, we have our kids, we have our husbands, we have our wives, whatever it may be. But we also have us. And I think a lot of times as women, we forget about us.
100.
And this is a place that we hope people can come to and remember themselves and make sure that they are putting themselves first.
Right.
And yeah.
Well, and I think the key word is solidarity, right? Like, we're all in this together. And you are not the only one, even if you're thinking so, that is going through all these changes. I mean, I love that there's more of a push to educate women on this and to learn about this. And I hope that I can be a small portion of that, right? And like you said, if one person gets something out of this, then I did what I came here to do.
Absolutely. Why don't we talk about a few of the subjects that we hope that we'll have episodes on? I think that would be
absolutely.
good.
So we're going to talk about quite a few things. Hormone replacement therapy is a huge one that I think will be actually moved into quite a few different podcast episodes, just because there is so much to it, and it's a big subject, right? The other thing that I think is important is also talking about like vaginal dryness, vaginal health. When do you get a pap smear? Like, how old do you have to be? I know that when I got my first pap smear, I was only like 16. And honestly, that's not the recommendation anymore, right? The recommendation is actually a lot older than that. So I think that that's important for us to know, but also for our moms to know, these moms that are raising 13, 14-year-olds that I see in the clinic and asking, when should they bring their daughter in, right? Of course, they can bring their daughter in at any time to see me, but when do they need that first screening and why is it necessary? Vaginal dryness, obviously that's a really important subject that I think a lot of us kind of push under the rug and don't talk about, and that's also really important.
Yeah, there's also things like infertility.
Oh, absolutely. And how honestly, how often that happens, right? And that not everybody just has sex and gets pregnant like we feared when we were I'm just going to say 18.
What age? What age,
Oh, okay.
Yikes.
We're not going to talk about that. 18, okay? Maybe 21. Okay, we're changing the subject.
Okay, let me take over. You sit back for a second. I also think that breast health is something that we'll touch on, which is very important, as well as let's talk about IUDs. Let's talk about contraception, things that, primarily it's birth control, but there's certainly other ways to have contraception.
Oh, without a doubt. And then PCOS, right? Polycystic ovarian syndrome. That's a huge thing that I see many women for weekly, and how to diagnose it and how it's diagnosed. And is this something that's going to prevent me from going through the normal stages of my life? Is it something that's going to prevent me from getting pregnant? That's also really important.
Yes.
Another one that I actually talked about with a close family member yesterday was pelvic floor health. I would love to have a pelvic floor therapist that I know come in and chat with us and talk about how important the pelvic floor therapy is. And, I refer patients all the time for pelvic floor therapy and what that does, right? Does it help with the incontinence that happens after we have a baby, or the incontinence even before having a baby? When we pee on ourselves, when we sneeze, laugh, or cough, right? That's real. And so it'd be important to talk about that too.
Absolutely. And also, how about let's talk about an orgasm?
Oh, yes. Important.
Let's talk about issues not being able to achieve an orgasm.
Right.
Or I'm having painful sex.
Right.
These are all things that happen to everybody, but it's just not talked about.
Right.
So that's what I'm hopeful that we will be able to chat about.
Absolutely.
And also, I guess to go forward with that, we want to definitely have input from people. And since we have so many listeners, I'm sure we actually have an email address. It's questions@lubetubepodcast.com. And we are asking anybody and everyone to just send in questions that they may have. It'll be totally anonymous.
Yeah, for sure.
But we definitely would like to get some input from people, because we know what we want to talk about, but we certainly want to get input from people that have questions that we have not yet answered. So.
Yeah, and I think the other important part is I want to be able to create a space where women can learn and be able to take that information and move it forward to their visit, right? Their visit with their provider. If that's a physician, a nurse practitioner, a physician assistant, whoever it is that they're speaking with at that time, I want to create that open dialogue for them. So I think it's important that we create that for that person and open that up for them.
Absolutely. Absolutely. Well, I think that we may have covered it all for now. We wanted to kind of keep this one as short and sweet as we could, but also introduce us, what we're doing, and just get y'all ready.
Yeah. Ready. So like we said, this is the Lube Tube, and the Lube Tube is brought to you by Celebrations Bridal and Prom, and we can't thank our sweet friend Ashley enough, right? So anyways, we're looking forward to sharing our details and our information and all of our knowledge with you. And I think it's important for you to understand that the information provided in this podcast is for general informational and educational purposes only. It's not a substitute for professional medical advice, diagnosis, or treatment. We want you to always seek the advice of your physician or medical provider with any questions you may have regarding a medical condition or your sexual health. Never disregard professional medical advice or delay in seeking it because of something that we have said or you have heard on this podcast. The hosts, guests, and producers of this podcast do not assume any liability for the application of the information discussed, and reliance on any information provided by this podcast is solely at your own risk. I just want to thank y'all today. And thank you, Brittany, for getting up early, like really early, guys, on a Sunday morning and meeting me here when you could be doing so much more than just sitting here with me and looking at me and my brown eyes.
It's been a pleasure, guys. We will talk to y'all soon.
All right. Bye.
Bye.